Hi, I'm Mary Dehaan. I'm a nursing instructor over at the Bolton School of Nursing. And I guess if I had to talk to you about a couple of tips to make life a little easier for you as you study for nursing, I would think about maybe three things. First of all, look at what has worked for you in the past, either when you were in high school or any of your classes here at CASE. What is your learning style? Did you like to write things down? Do you like to hear things? Do you read things? Do you work best when you talk with other people or study in groups? A lot of the things that worked for you in the past are going to work for you again when you start studying nursing. Nursing, though, is going to be very, very different from anything that you've done in the past. What we do in nursing is we look at things holistically. We don't just look at all the pieces and parts, we try to pull all of those things together. Think about the topics that you learned in nursing school. Every single topic is going to build on each other. You never are going to take one thing and just put it aside after you studied it for a test or you've written a paper about it. You keep learning and building from everything that you've read, everything that you've experienced in clinical, everything that you've talked about with your peers, with your instructors, with the staff at the hospitals. So you're going to approach it very, very differently in that regard. Talk to folks within your dorm, to your families, your parents, your sisters, your brothers. If you can take concepts that you've learned in any of your classes and explain those concepts to people who are outside of nursing, then you know you really have understood a concept. You're able to pull all the pieces together, and you're going to be able to remember things well beyond the time that you take the test or you write the paper. You want to keep that information so you can carry it over and take really great care of your patients and your families. Some tips to do that, again, looking at those learning styles. Can you get together in small groups and discuss what happened in clinical? Look at the patients that you had in clinical and say, hey, is this something that I learned in class? Can I pull out some concepts and maybe explain those concepts to people around me or maybe to the patient? If you're more the person that likes to hear things and read things, make note cards for yourself. Try to explain some of the concepts that you put on those note cards. Don't put off studying because, especially in nursing, since everything builds one on top of the other, you're going to find that the night before the test or clinical or a paper, there's a lot of information to get through. And you just don't process information like that in nursing. You have to really keep building and building topic after topic. Which would then to my last point of advice that I would give you. As nurses, if we're going to be taking care of patients and families and communities, you have to take care of yourself. Are you sleeping okay? Are you eating? Are you resting? Are you having fun at the university? Enjoy the university experience. Don't just bury yourself in all of the books. You're not going to be able to comprehend anything that way. It's not going to build on itself if you're so tired, so exhausted, and so stressed out that you can't even remember your own name at the end of the day.